After a proper test has been carried out and it has been ascertained that you have malaria, we proceed to treatment, right? But do you know that many of our antimalarials, that is drugs for treating malaria, are dosed based on your body weight? So what this means is that your body weight determines the strength of the anti-malaria you'll be taking. When I say strength, I mean the milligram of the anti-malaria you'll be taking. So the first reason your anti-malaria is probably not working for you is because you're not taking the dose that's recommended for your body weight. So you can always speak with your doctor or your pharmacist to guide you on this. Now the second reason your anti-malaria is probably not working for you is because you are not completing your dose, or you probably are not following the dosage interval, the time interval you have been instructed to follow. Yes, I know once you commence the treatment of malaria, from the first, second day, you may start feeling better and you probably might be tempted to stop your drugs. Now, this is where the mistake is being made. Now, the problem is once you stop your drug, once you don't complete your dose, or you probably don't follow the timing you have been given, you take whenever you remember, the problem of resistance starts setting in. What this simply means is that the malaria parasite you are trying to treat in your body begins to form resistance to that drug. That is, by the time the drug is not coming in as expected, this will give the malaria parasite enough time to change their form, enough time to gather more momentum to resist the effect of this drug. Now, once this drug now comes in later on, the drug no longer works for them because this malaria parasite have already played a fast one on you. So you see why your drug is not working for you? Now, the third reason may be as a result of self-medication. When you self-medicate, you do not get the adequate information you need on each of those drugs you're taking. For example, there are some drugs that can interact with your anti-malaria and render your anti-malaria useless. There are some food that can also interact with your drug and render your drug useless. So you see why you shouldn't self-medicate at any point. One final thing you should also take note is make sure you are getting your drugs from a reputable source, a reputable pharmacy, so as to ascertain the quality of drug you're getting and the efficacy of that drug. Trust me, if all these things I've said so far can be done, your anti-malarials will definitely work well for you, except village people are following you sharp. Always talk to your doctor or pharmacist before you use that drug. Your life matters.